to the next session of the COVID oversight inquiry being undertaken by the Public Accountability Committee. The next two sessions will be focusing on the situation of COVID and prisons across New South Wales. Almost 13,000 inmates are in our prisons across New South Wales, one of the most vulnerable populations, vulnerable from a health perspective with many comorbidities, but also vulnerable from the circumstances in which they are held in very close proximity. Our first panel has a number of advocates from the community and also the Public Sector Association. And I'll just work through each of you. If each of you could in turn provide us with your name, your position, and then take either an oath or an affirmation. Copies of the oath or the affirmation should be provided to you by the Secretariat. Mr. Brett Collins, we may start with you, Brett. Again, if you give your name, your position, and then take either an oath or an affirmation.
Yes, my name is Brett Collins. I'm the spokesperson and coordinator for Justice Action, and I'll take the affirmation. I will say, give the truth, the whole truth, and nothing but the truth.
Thanks very much, Mr. Collins. Mr. Keenan Mundine.
Thank you. I'm Keenan Mundine, co-founder of Deadly Connections and Deputy CEO, and I'll take the oath. I swear to tell the truth, the whole truth, and nothing but the truth.
Thanks very much, Mr. Mundine. Professor Anthony.
My name is Thalia Anthony, and I'm a Professor of Law at the University of Technology, Sydney, and I affirm that I will provide the truth, the whole truth, and nothing but the truth.
Thanks very much, Professor. Professor Newhouse.
Yes, I'm George Newhouse. I'm the CEO and Principal Solicitor of the National Justice Project. I affirm that the evidence I will give today will be the truth, the whole truth, and nothing but the truth.
And Mr. Bradshaw.
Nathan Bradshaw, Industrial Manager at the Public Service Association of New South Wales. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God.
Thanks very much for coming and sharing your time with us. I know how busy everybody is, and we really do appreciate it, especially given the short notice. Then now is an opportunity for each of you to give a brief opening statement, because we do want to leave time for questions. And I might first go to you, Mr. Collins. Oh, Brett, you're still on mute.
Thank you for the opportunity to present. So I speak on behalf of prisoners, right, inside the jails, and also families of inmates who are prisoners who have actually contacted us over the last few weeks. They are extremely distraught. They have, as one can imagine, at the moment they're locked down, and they can have a sense of impending doom. We've been contacted by hundreds of families of prisoners, and we've also and prisons themselves have made contact with us. What we have at the moment, we have a situation we would see just before the infections enter the jails, an opportunity for many things to change. And behind that, we have received a lot of information from prisoners about prison conditions. They're locked in their cells. They have a time. Some of them only get out for 10 minutes a day. Conditions that are entirely intolerable. This is exactly the situation which we foresaw back at the beginning of this year, and we asked the Commissioner to use his power to release prisoners on parole according to the Act, which is the Section 276 of the Crimes Administration Act. And nothing so far has happened about that at all. There's the same density of prisons as there were before, with 13,000 prisoners sitting at the moment in their cells. We have reports from prisons in Parklea, in Bathurst, in the South Coast prison, where they haven't had vaccinations. They're locked in their cells. They've been had vaccinations refused. In some cases, they've actually been told that they can only receive Pfizer and not AstraZeneca. So anyone over the age of 60 has been refused access to Pfizer, and there are prisoners who've been requesting vaccinations in their families and have been refused. These people also locked in cells, and we have people who are in dormitories, and we have a very specific information about people who are in dormitories, women and men, who are in dormitories who have not been vaccinated and have been asking for vaccinations over the period. People who are in Clarence, in the Serco prison, who are in Parkley, who are also down in the South Coast and further south. They're quite across the whole system, there's tension, and prisoners are expecting that they do receive the same conditions as is permitted in the outside community, where they have an area of not more than at least 4 square meters per person in order to survive these conditions. We are currently preparing a case before the Supreme Court for the acting commissioner to be compelled to ensure that the cells have not more than 4 square, have no greater number of prisoners per cell that allows them 4 square meters per person. That vaccinations should be mandatory for all staff, and that vaccinations should be made available to all inmates, and that they should have time out of their cells, at least that should conform to clause 53 of the Administration of Regulations 2014, and that they have access at least to computer tablets that allow them to facilitate communication with them, the legal representatives, medical and mental health professionals, family, as well as access to whitelisted websites, giving them education and rehabilitation services. These things are achievable. In some jails, they do have computer tablets. In many jails, they do not. And these are issues that could easily be complied with by the Acting Commissioner of Corrective Services. We're going to the court to ask that be mandated. And thank you. Thanks for the chance to speak.
Well, thanks very much, Mr. Collins. I'm sure we'll come back to you for questioning. Mr. Mundine?
Thank you. Before I talk, I just want to acknowledge the traditional custodians of the land that I'm on, the Gadigal people, on the Eora Nation, and pay my respects to elders present. As an Aboriginal man, and one with lived experience of being in prison here in New South Wales, it's both an honour and a duty to amplify the voices of those people that are still in there and their family members and loved ones in the community. This is more than a job for me, as many of the people inside are my family and from my community. I'm here today to try and talk about the lack of accountability of the way in which this was being dealt, the lack of transparency to loved ones and community around how they're dealing with their loved ones in custody here in New South Wales. I want to talk about trying to increase relationships with Aboriginal community controlled organisations with the Department of Corrective Services to take care of all of the Aboriginal members in custody today, to ensure that they're being treated and supported. We had a briefing last week with Corrective Services, and in that briefing we offered to provide a toll-free number that we have at Deadly Connections to all of the Aboriginal people inside, to ring this number toll-free and get support and services and to be able to stay connected to their family. We also want to talk about the lack of mental health and care plan for every individual that's in custody today, not just to tick a box, how do you feel today? They are locked away in a cell. Like Brett said, some are 2 out, 3 out, and 4 out. And even if you do put your hand up to speak to a counsellor or a psychologist or somebody from, a clinical background, you can't disclose in front of your cellmate how you're feeling, what you're going through, and how you're struggling and what you can do to cope with that. Being no direction around how they're going to do this. There are programs that have been put on hold, and these programs are necessary for most sentenced prisoners and unsentenced prisoners to be able to get access to these programs, to be able to show the court that they're addressing their offending behaviour, to be able to be, comfortably released to the community and lower their risk of reoffending when coming back to the community. There's been no sort of parole eligibility and people being released since COVID. There's also been no PPE handed out to inmates. The only time inmates come in contact with PPE is when they're accessing the clinic or coming into contact with staff. There's also one of the most sort of distressing cases that I can sort of put forward was we received a message most recently that a member of our community went back to prison to serve a 2-week drug court sanction, and that was before the most recent wave, and he's now spent 3 months in prison without no sort of action and recourse on when he's coming home. In the time that he was in prison, he had a baby, and he hasn't been able to touch that baby or bond with that baby or talk to his family. So Thank you very much for allowing me to be here today and bring my lived experience and shine a different light on, what's happening and how prisoners will be feeling.
Thanks, Keenan. Professor Anthony.
Thanks, and respects to the lived experience of Keenan and Brett, and also acknowledge that I'm on Wongal country. So since February 2020, I've conducted and published research on the impact of COVID-19 on prisons. The warning sign first came in Wuhan, when its prison had higher rates of COVID than the general population. This is now also the case in New South Wales. As of 8 p.m. last night, the New South Wales government has reported 283 cases in correctional settings since the 31st of August 2021. This translates to 2.2% of the prison population with active COVID-19 infections and compares to 0.2% of active cases in the general community. At the same time, the proportion of inmates who are fully vaccinated is less than half of the general population. There is also evidence of people entering and leaving prison while infected, which has adverse implications for the broader community. The New South Wales government enacted legislation early last year to enable the Corrections Commissioner to release on parole classes of inmates. This should be acted upon as a preventative measure to lower the square metre prison density, to prevent prison deaths in custody, and to prevent infected people being released into the community at the end of their sentence. Finally, apart from the parole release, the New South Wales Executive could advise the Governor to grant sentence remissions based on its prerogative remissions power. Reviewing the eligibility of all sentenced inmates for remissions would recognise missed work release, restrictions on programs and visits, the mental health consequences of lockdowns, as well as controlling transmissibility. Indeed, there's a need for inmates to also have access to masks, PPE, vaccines, and community health care, as well as testing in advance of release. However, it is only through fewer people in prisons that COVID can be controlled in prisons. Thanks for the opportunity.
Thanks so much, Professor Anthony. Mr. Bradshaw.
Thank you. Yes, I also like to acknowledge the country that we all meet on and pay my respect to elders past, present and emerging. Firstly, apologies for Nicole Jest, who is the chair of the Prison Officers Vocational Branch, who is unwell. I am stepping in as the industrial manager that looks after the justice sector of our membership. Our members that work in this setting in and around correctional centres turn up to work every day under enormous pressure and new ways in which they are doing their job when it comes to practices and safeguards in place to minimise the risk not only to staff but to the inmates as well. They do so, like I said, in an environment of a political environment with a lot of misinformation about vaccines and their effectiveness. However, there has been an announcement of mandatory vaccination for staff, which our members recognise that there is a risk there in those settings, a risk that also exists for the inmates as well, which does give rise to the question if vaccinations are mandated for staff with the first dose to be received by the 30th of September, what is the plan to vaccinate or to possibly mandate vaccination for inmates? It's a question that our members are also asking to minimise the risk, not only to staff, but the risk that exists to the inmates as well. Thank you.
Professor Newhouse.
Thank you, Chair. Like Thalia, I'd like to pay my respects both to Brett and Keenan's lived experience and also to the Gadigal people on whose land we are today. Well, I certainly am, and a number of you are. Look, during the pandemic, the government has made it clear that the lives of prisoners were deprioritised by diverting urgently needed vaccines from prisons and their abject failure to develop an effective plan to prevent prisoners from becoming infected with COVID-19. Now, the recent media attention and focus has seen vaccination rates rise from 21% to 35% fully vaccinated, but it's still too low and too late. Now, prisons are exempt from COVID-19 health regulations, but the public and prisoners and their families do not know what guidelines and procedures are currently mandated in prisons. The people of New South Wales are entitled to know exactly what is planned for prisoners right now. The New South Wales government has a duty of care to prisoners, especially those that they know are vulnerable, like elderly prisoners, Aboriginal prisoners, and those with underlying health conditions. We know from the stats that around 25% of those with COVID, diagnosed with COVID at Parklea Prison, were Aboriginal prisoners, which is of great concern. Not only are Aboriginal peoples overrepresented in prisons, but now they're overrepresented in COVID-19 numbers. There is no transparent plan. There are no transparent statistics. There's nothing to hold the system accountable for its performance or lack of. It appears to be a fly by the seat of your pants stuff. If there is a plan, then let's hear it so that families and prisoners know what they can expect, in fact, demand from the department and operators. The prisoners are sitting ducks to pandemics in confined, overcrowded and unhygienic areas without adequate masks and sanitizers. They're being locked down, as you've heard, in intolerable conditions. Often a prisoner's release is actually being delayed by COVID because they're unable to access programs. Programs have been shut down, and the parole board often requires prisoners to have met certain requirements of these programs before being released. Parole guidelines need to be varied during COVID to allow for this. Lockdowns and uncertainty is causing significant psychological harm. And finally, the lockdowns are not only in breach of New South Wales law, as Brett mentioned, but they're in breach of the Convention Against Torture and Other Cruel, Inhuman and Degrading Treatment or Punishment, which defines torture as the infliction of severe physical and or mental suffering committed under the law. And it's noteworthy that CAT allows for no circumstances or emergencies where such conduct is permitted. And I think it's very important that we consider the mental health of prisoners right now who are being locked up in intolerable circumstances. I'm happy to answer questions.
Thank you all for your openings. I'll hand over now to the opposition. I think Tara Moriarty.
Thank you. Thank you all for attending today, and I really do appreciate your opening statements, but also the work that you do in this space. I might start with Mr. Bradshaw, if I could. Mr. Bradshaw, in terms of staff, particularly guards, but all staff in prisons, what are the current what's the current vaccination rate? Are you aware?
Unfortunately, I would not have the accurate figures for that. However, I do have for our members, a member survey in which over 12,000 members responded. And the response to that, respondents from our membership, which includes the prison officers, indicated, and this was 2 weeks ago now, but indicated that there was 76% of respondents had one dose and 54% were fully vaccinated. We believe, and that was 2 weeks ago, can only estimate that the coverage in the prison officers would be quite similar.
Yeah, thanks. And so now that it's going to be compulsory for the guards to be vaccinated, would you say, or what's the view of your members in terms of their ability to have accessed vaccination to this point? And the deadline is when is it, the end of the month? So what's the access rate been like?
So the deadline for the first dose is the 30th of September, so the end of the month. There has been more than one round of vaccinations rolled out to the centres. Our members, however, in regional areas do, report the same issues as a previous speaker when it comes to gaining access, not only to a vaccine, but the vaccine that either their GP has recommended or that they have, a preference for. And also, I believe the members are reporting they should have the ability to gain that vaccine from their GP. And for some members, they are having problems with gaining, if they want an exemption, if they are seeking an exemption for medical reasons, with gaining those appointments in time. But however, the access to the vaccine, there has been issues, but mainly in regional areas.
Yeah, thanks. And so has the government or corrections worked with you or your organisation or the staff in terms of what will happen to staff who are not fully vaccinated by the deadline? Will they still be able to work? Will they be on leave? What will happen?
They're currently in discussions about that. The announcement for mandating vaccinations was made yesterday. There was a risk assessment process that we have been involved with for the weeks leading up to that. So the risk, obviously, we were aware of, that it could have been heading to this. But yes, that announcement was just made yesterday. As for what happens to the staff, there will be a process. There is a similar process that is happening for police employees. So there will be a process for seeking exemptions. But as to exactly what happens to the staff if they refuse to be vaccinated is still a matter for discussion.
Thanks. Now, just in relation to the protocols in place for managing COVID, I know corrections is kind of its own world, but the health advice and the health rules in relation to COVID apply to all of us. So I guess on behalf of your members, is that what's happening in corrections with staff? The normal health rules that apply to the rest of the community, do they apply to staff, or does corrections have its own set of rules in relation to, for example, staff who might have symptoms of COVID? Are they supposed to isolate for 14 days, or people who've been exposed? Is that the requirement?
It's certainly my information from everything that I've seen in my discussion with members. They're absolutely bound by the same restrictions. In fact, they have a COVID command post that works with population health, justice health, in terms of contact tracing, and for the majority, there are further restrictions or more caution being placed on testing, etc. So there are a number of testing. The members are tested every day when they turn up to the centre. So I would say that they are above the restrictions.
So that's the requirement. But I'm wondering if you can respond whether you would be aware of this via your members or not. I'll certainly be asking corrections about this. But I've been advised that there are cases where the health advice that we all have to follow is not being enforced by the COVID command in corrections, and that there are circumstances where, in fact, it's been told to me that they are staff are being told or pressured to come back to work before the 14 days if they have been exposed to a potential COVID case, or perhaps within the 14 days have received one negative result but aren't being asked to isolate for the rest of the period. Do you know anything about that? Have you got any comments on that?
My apologies. I don't have that information. It's not what I've heard. So my apologies.
That's okay. And in terms of staffing issues, so just like the rest of particularly the health system or all frontline workers who are working at the moment, there are stresses on all of our frontline workforces when people have to take this 14-day period because they might have been exposed. I would imagine that's happening in corrections. Are there shortages of staff? How is that being dealt with by corrections?
It's certainly stretched to the limit. I don't think that's an unfair statement. I know that the casual pool is reaching the limits. And I know that I'm aware of a number of staff that have been recalled that were not in active duty, so to speak. So the pressures are there, and certainly further increases and outbreaks is really going to strain the system, as well as from the 30th of September, if there is a sizable cohort of workers who cannot comply with the mandate and will not be at work, that will, create further stresses on the workforce.
Do you know if there's been any planning around that, or as you've said, there's still discussions happening about what that might look like?
There's still discussions, but there's no doubt that the policy at the moment is that from the 30th of September, you will not be allowed to turn up to work unless you have had one dose of vaccine.
Thanks. So I mean, there's been quite a lack of transparency, in my view, about COVID, and certainly this particular outbreak in the system. I'm also advised that staff have been instructed and in some cases threatened with disciplinary action if they speak out about COVID cases. And in fact, the outbreak at Parklea wasn't made public until it was exposed by us. Do you have any information or any comment on that?
My comment would be, I'd like to preface by saying that I don't look after the private prisons. I have not had a huge involvement in Parklea. However, my comment is that there is quite a strict public sector code of conduct, and our members are often threatened for speaking out on issues that they should be able to.
Yeah, that's something I've discovered in the very short time that I've had this portfolio. So I understand for staff working in places that going to the media might be a problem, but I'm also advised that they've been threatened if they want to get advice or deal with these things in any other way. So you're welcome to get them to contact us if we can assist with that. Is there enough or appropriate protections in place or gear in place for people, particularly in regional areas, would you say?
Look, I think the PPE rollout was slow in the beginning. I don't think there's any doubt about that in the beginning of this lockdown. However, I think from my reports and discussions with members, there is certainly the provision of, I think it's N95, forgive me if I got the numbers wrong, but the masks, the face shields, goggles, there are multiple procedures in place, and it certainly does, whilst the PPE is certainly valid, it does make our members doing their job increasingly difficult to be to use all that PPE at the same time.
Yeah, thanks for that. And if I could just turn to, I guess, collectively, all of the advocates that we've got here. So feel free, each of you, to jump in. I, like you, have been inundated with correspondence and calls from family members who are very concerned on behalf of their family members who are incarcerated at the moment. The government did make mention, and the minister confirmed a couple of weeks ago, that they were looking at releasing some low-risk inmates. I understand they've since said they're not doing that. I know a few of you are doing work on this and potentially a legal challenge. Where is that up to, and what kind of response have you had from the government in relation to their up and down answers on this?
Well, maybe I can respond to that, Ms. Moriarty. We currently have a barrister and solicitors working on the case. It's not yet ready to present to the court, but there's still some research to be done. We have, at the moment, 12 plaintiffs looking for a class action, and so really on the back of quite a few things there, but to grant parole to for the acting commission to grant parole to a certain class of prisoners. We have at the moment, as I say, we have 12 plaintiffs, but we have well over 100 who actually want to present their case before the court. We're concerned about a whole range of things, but if I can just address the issue that Mr. Bradshaw referred to, which was mandatory vaccinations for prisoners. Of course, many prisoners do want vaccinations, but then there's a lack of trust between the health, Justice Health and prisoners. And the last thing we would want to have would be for prisoners then to be forcibly vaccinated. That doesn't happen anywhere else in the community. And to propose that, I think is really a bad thing. That's a bad thing for a whole range of reasons. First of all, of course, prisoners don't have the choice. They're sitting in a cell, and the health department should be actually offering services and not compelling people to do things. And of course, they're not employed, therefore they don't have the benefit of actually not leaving the area. They also they don't have their own doctor. So if they had their own doctor, and of course they had access to health advice, they may well in fact accept the vaccinations. But that's that communication between the prisoner and their own doctor is essential. That's why the people are saying, well, we have a situation now where pressure is building in the prison system. What we have for Mr. Bradshaw is in fact it's going to get worse. We all know that's going to happen. That's why effectively something has to happen now. And we look to this inquiry to actually make sure that does happen. But as it builds up more and more, we're looking for it to be a bomb, a blow up. And that would be really unpleasant for the whole system, including Mr. Bradshaw's staff, as I'm sure he's fully aware. So what we're suggesting at the very least, and what prisoners' families say, at least let us have computer tablets in the cells, as is happening in some areas and has been promised. Because at least people have easy access then to their families, legal support. We can get proper reports about what's actually happening. They can get proper support, health support as well from their own doctors. And they're things that will make a big difference. And then they can also use their time properly if they're left in their cells for long periods. At least they do have access to some positive way in which they can use their time. That's basic. And so far we haven't had a response to that.
Can I just add to that? I strongly recommend that the Aboriginal Medical Service be funded to attend prisons and speak to First Nations prisoners. I think that will lead to higher vaccination rates amongst that cohort. And in relation to one of your questions, Ms. Moriarty, about the public health orders, there are specific exemptions for prisons, correctional facilities and youth justice centres or other places of custody. The gathering social distancing requirements are exempt, and there may well be other sections of the normal requirements on the public that are exempt in prisons. It would be worth asking the department what they're exempt from too, or the health department.
Yeah, so thanks, and I'm aware of that, but I'm also interested in the minute that I have left, I think, in comments from you about the treatment of inmates. So this particular outbreak seems to have caught corrections off guard, in my opinion. They seem to have been caught out, and then late August locked down all of the facilities across New South Wales, and some of them were reopened and some of them took a little longer. I haven't got a complete answer on whether they're all open, but it means, as you know, a lot of people have had not much access to fresh air or communication. Have you got any comments about that? And also particularly, are you aware, I've had comments from family members that COVID positive inmates have been refused contact or refused to be allowed to contact their family members. So corrections will tell families, but they're not allowed to speak to their loved ones. Any comments on that?
Well, I can certainly talk to that, actually, Ms. Moriarty. We have a number of reports from families who do have COVID positive prisoners at the moment, who haven't spoken to them for 3 weeks. They've also been lied to about their status. They've been told that there's nothing to worry about at all, although they haven't had contact with their loved ones in Parklee, particularly Parklee, for the last 3 weeks. And then afterwards, they've been told that their family member is positive after all, after having been told previously that it's not the case. So there's a lack of transparency, definitely, lack of communication as well, which is really, really very, very difficult for family members outside, as well, of course, the prisoners themselves.
Thanks, Ms. Moriarty. Unfortunately, your time has expired for this round of questioning. Professor Anthony, I saw that you wanted to contribute to an earlier question.
Yeah, thanks. I just wanted to say in response to the question about the Corrections Commissioner's position on release, we have penned 4 open letters from thousands of justice advocates over the past 16 months, including one a few weeks ago that was sent to the Commissioner, and have not received a response and not had any information about the, I guess, criteria that would trigger the release. So it was said, including up to a few weeks ago, that it could require an outbreak. When there has been an outbreak, it again has not triggered it. So I think it's really incumbent on them to provide information as to when the powers will be used.
Mr. Collins and Mr. Mundine, the inmates that you've been speaking to or had communication with, What have they said about access to vaccines? We hear a lot of rhetoric from the government about vaccine hesitancy, but can everyone get a vaccine when they want it in prison, Mr. Collins?
Well, no, they can't. In fact, we've been told by many people that they've actually been refused access to vaccines. We have a number of reports here, which I'm very happy to pass to the committee if that would be useful, from people who've been refused and people who've been told that the that vaccine does not apply and therefore they have to wait until the AstraZeneca is available. And so there've been many people in that category, people over the age of 60 who haven't had access to vaccines. People have been asking for vaccines for months and have been refused. So, and people have had to pay for vaccines as well, which is really quite a surprising situation. So there's no question prisoners know that it would be to their benefit to be vaccinated. But of course, some people would be resistant to that, but they certainly would prefer to be, if that's to be the case.
Mr. Mundine?
Yeah, I'm just going to follow on with what Brett said. My brother's actually in prison at the moment, and I'm really highly anxious about his welfare and what he's going through. And I have a lot of old associates still in custody at the moment that I talk to, and I guess the biggest thing that has become more apparent here in New South Wales is that every prison runs their prison the way they want to. Then there is no sort of mandated sort of guidelines on every prison operating the same, giving the same pathways to getting access to a vaccination. Up in Clarence, I have a friend who's already been vaccinated. My brother got vaccinated the other day, but the way in which it's rolling out is like you have to go to the clinic, fill out a form, then ask for it, and then when they're ready for you, they'll just page you on a random day. It's not like, here's your appointment, come up on a Tuesday at 2 o'clock, you're going to get it. If you have any concerns, here's some information, here's a number that you can ring, here's somebody in the community that you can talk to. So they're getting bombarded. My friend who was in Clarence actually got offered his vaccine whilst getting dosed in the morning, his opioid replacement therapy program. So he had to decline it, give me a phone call, and I had to sort of talk to him about his options, and he opted to go back to the clinic and get vaccinated. But he was very, very highly anxious by walking up there to get his methadone in the morning and then tried to corner him in a room and say, hey, while you're here, you want your jab? Yeah, like everybody else said, I feel like most of the Aboriginal community in custody are going to be very hesitant. They don't trust authorities as it is. And what George said, I second that, trying to get the Aboriginal Medical Centre into local custodial centres to be able to reduce that sort of heightened state of distrust and to be able to administer vaccines to the Aboriginal population.
That is a pretty obvious solution, isn't it, Keenan, to get the Aboriginal medical service in, a trusted source, an authoritative source outside of the prison system. That's a way of getting to particularly First Nations inmates in a trusted way to increase vaccine rates. Do you agree?
Yeah, I fully stand behind that comment, and I'm glad that George brought it up. And I feel myself as a former prisoner, having somebody from my local medical centre, that I've grown up with, having access to them, and a doctor and a nurse coming and comforting me in such a heightened state, and to be able to sit with me. Most of these routinely jabs, as you would see rolling out in the community, you just get your jab, you sit for 15 minutes and you take off. That sort of is heightened in custodial settings. You already don't trust the staff, you don't trust the nurse, you don't trust the custodians. Who do you talk to about your fears, your anxieties, and what you go through? And then what's the repercussions of you disclosing, that you're unstable? Most of the time when in custodial settings, when you say you're unstable, you get locked down even further, and then you get your restricted, so you get your clothing removed from you, and you get a safety blanket, and you get put in a cell with a camera, and you get further isolated. So it's a very tricky situation, and I'm very honoured to be here. So thanks, David.
Could I ask, probably again to Mr. Collins and Mr. Mundine, about the lockdowns? One of the responses to COVID in prisons has been to lock prisoners in their cells, sometimes for the great majority of the day. What are you hearing on the ground?
Well, I can tell you that there's an immense tension in the prisons at the moment. People are being left in their cells for whole periods, except for 10 minutes, Some people being allowed out for a little bit longer than that, and it's just enough time to go out and have a shower and have access to a phone call, sometimes to a phone call, and then back in again. Like there's a whole the whole system really. It's very easy to just lock people in their cells. Obviously, it's easier from a staff's point of view because all they have to do is open the cell and close the cell door. But that only that only lasts for a short amount of time, and then at the end of it, you have people who actually they talk about staggering out in the sunlight after they finally come out in the sunlight after a period inside. That has immense impact on a person's feeling about themselves and how they can fit in the general community. That'll have reverberations in the general community later, without any question.
Mr. Collins, when you say 10 minutes, do you mean 10 minutes in a 24-hour cycle?
Yes, 10 minutes in a 24-hour cycle. That's right, and we're having that widely across the board, actually. It's quite surprising how little time people get out, even out of places like the South Coast Correctional Centre at Nowra. We're getting that same report in there. We had a report of a man who was there for 17 days in his cell and did not leave his cell. So that's the sort of situation where people are seen as being locked down. Lockdown means it's different than a general community. Lockdown, we're talking about locked in a room and then with one or two other people with you as well. That's just an amazing situation that would normally never happen, would never be even considered. And yet it seems here has been a safety situation, which is really totally intolerable.
Mr. Mundine?
Yeah, even in the best of times, locking a prison down is hard and trying to get through such a process. And all of the research and evidence will show that locking prisoners down, only exacerbates their mental health and some of their behaviours and experiences. And the ultimate sort of pinnacle of a lockdown would be an inmate taking a staff member hostage or assaulting a staff member. But then on the other side of the coin, we won't really understand the full impact of the psychological and mental effect of the state being locked down and every prisoner in prison. It might happen tomorrow, it might happen 2 weeks from now, it might happen 2 years from now, but that's when the impact will happen, and that impact will go directly to their household, their loved ones, and those around them. Watch them suffer from what they had to experience being locked up in a pandemic.
Professor Anthony, could I ask you about the need for transparency? We had last year, during the heat of the crisis last year, there was greater transparency about what's happening in prisons than there is this year. Can you speak to that at all?
Yeah, so last year, every time there was an infection on the New South Wales Corrective Services website, they would report whether it was staff or an inmate. They would report the numbers, and then if they were being transferred, say, to Silverwater for treatment, they would report that. And there were very few cases, admittedly, last year. And now when we have hundreds of cases, the only information we are getting is from the daily COVID statistics from the New South Wales government that puts a number to correctional settings at large. So there's no specificity as to who is affected and where they're affected or how they're being treated. David, you're on mute.
I had to do that at some point. What is the transparency we should be expecting? Is it COVID numbers broken down? Obviously, it's quite distinct if it's officers rather than inmates. And should it also be on a facility by facility basis?
Yeah, I think there needs to be absolutely that level of detail around infections, facility by facility, including youth detention centres, where we've also heard there have been cases. But in addition to the numbers, and those numbers should extend to vaccination numbers and testing numbers, in addition to that, there should be reporting from inspectors, custodial inspectors and ombudsmen about the conditions in prisons and youth detention centres and what the experience is like inside, but also what protections are available. And apart from that, there needs to be transparency about the policy. What are corrective services doing to manage the outbreak? What are they doing in relation to their powers of release, etc.?
Mr. Bradshaw, you said that there was some masks being provided to staff, but is it true that there's no PPE being provided to inmates?
The information I have is that they have surgical masks provided. If you would like, again, I could take the question on notice as to exactly what PPE is being provided, but my information is that they are provided surgical masks for common areas and transportation.
No hand sanitizer, no effective face mask.
Hand sanitizer,
No.
yes, but the surgical mask.
Mr. Collins, Mr. Mundine, what are you hearing?
Now, we've heard for a long period, in fact, that they were not available to prisoners, and that also the staff were entering the cells without masks. So it was a real casual approach across the board. Now, more recently, things may well have changed, but it certainly was the case that there was a real casual approach and right across the board.
Yeah.
Mr. Bradshaw, family members. Oh, sorry, Mr. Mundine, did you want to add something?
Yeah, sorry, David. In my reports, that both from my people in prison, the only time they're ever afforded any sort of PPEs when they're coming in contact with staff or accessing justice health facilities. When they're in the cells, when they're in the yard, when they're in public areas, interacting with each other, there is no PPE. They're in close quarters, they're in yards, they're in cells, they're in, out in spaces together, and there is no PPE given to them. There's the basic that they give out, which is just a bit of soap and toothbrush and toothpaste, and that's it.
Mr. Bradshaw, family members contacted me about an incident in the South Coast Corrections facility yesterday where prison officers were refusing to wear masks and were locking prisoners in their cells as part of the response to that. Do you know anything about that?
I believe there is a industrial dispute ongoing on that matter. It is not one that I am running. However, I do believe that the transfer of prisoners has been delayed and locked down, yes, until the workers' concerns over the PPE. Now, the concerns are not necessarily having to wear the PPE, but the concerns are that it can be a safety risk in terms of the goggles and masks fogging up, or in terms of their supervision when wearing that PPE, and they're requesting that their concerns are explored before they transfer inmates.
Is it true that that crisis in the facility yesterday only ended when inmates called Crime Stoppers and complained about the absence of masks being worn?
I wouldn't know. Sorry.
You said no, or you wouldn't know?
Sorry. Oh, sorry, I don't know. No, that's not. I haven't heard that.
All right. What is the PSA's attitude towards compulsory vaccination for staff?
Well, the PSA is only interested in the industrial landscape of mandatory vaccination. We understand that there is a risk to, and that the employer has a duty of care to minimise that risk. We understand in this situation that the risk is extreme. It is death. We have members whose colleagues are unwell, that are in hospital, so in terms of our position on mandatory vaccination, we can accept that there are risks that need to be minimised, and that vaccination is a key part of that. What we are interested in is the industrial landscape of what happens to people who do not wish to be vaccinated, which we were speaking about earlier. Whether there is disciplinary action as a result of that, or there is an ability for them to take leave. That's the issues we're working through at the moment.
Unfortunately, our time has expired. I feel there's a great deal more we would be able to explore, but we do have the Inspector of Custodial Services, the Ombudsman and Justice Health coming next. So can I thank all of you?
Chair, will you take short written submissions?
Indeed, I'll give you this open opportunity to each of you. If there's anything further you wish to provide to us on notice, you're each welcome to do that. maximum period is 21 days, but if you could provide that in a shorter timeframe, that would be greatly accepted.
Yeah.
And again, I am sorry we have run out of time. Time has beaten us here. Thank you for all the work you've been doing. And there's obviously so much to do in this space.
Thank you.
Thank you. Appreciate the opportunity.
Thank you.
We're now going to have a short recess until 3:15, and then we'll have those various government agencies rejoin.